And fillers are rising in popularity. They make you look younger, but what happens when the procedure comes to complications? Well, that's why we have Dr. Michael Kim here this morning to tell us more about the cosmetic surgery and what kind of problems can arrive when getting fillers.
So I want to preface the conversation by saying that fillers are very safe in general. There's a very, very low complication rate. But I think it's important to not only understand, but also to recognize these complications early that we'll talk about. I don't know if we have any slides ready, but so fillers are very common. The most common filler is hyaluronic acid, HA, such as Juvederm or Restylane, and they're used to rejuvenate the lips, the cheeks, around the eye, off-label use between the eyebrows, the forehead, etc. And you can see the results are pretty good. Like the right picture, you can see how the tired look is improved, and how the lips are plumped up and people are happy. So the most common complications are bruising, swelling, etc.
Yikes, this is what we don't want to see.
One of the very rare complications that a lot of injectors aren't even that well aware of, which is surprising, is what they call intravascular injection. So I've seen a couple of these in a couple of patients who come from other places. And so what happens is, as you can see on the upper right slide, the normal facial anatomy, there's a bunch of arteries that go around the eye, around the mouth, around the nose. And these needles that we inject, sometimes under high pressure, are very small. So it's not terribly uncommon to accidentally get the needle in one of these arteries. And what happens is the filler, which is like a gel, goes into those vessels, and as you can see, it blocks the blood supply to that area, and you develop some redness, some swelling, some purplish skin. The skin starts turning a little bit dusky, and that's an early warning sign that you might be starting to lose the blood supply to the skin.
So what should somebody do in that case?
So there are a bunch of articles about how to treat complications of fillers, and I've seen several patients who come in from other places where they're just a filler place by nurses, or a weekend place, and they don't even have a number to call back. You can see on the bottom left, this is a very, very rare, I've never seen it actually, but this is a patient from, I think, China.
Wow.
But you can see how the whole nose skin necrosis, you can get lumps in the lip. And so there was a illegal buttock injection. You can see on the bottom left, that's a left butt. And you can see how that tissue just gets infected and dead. And just
you can tell,
some patients even die from these illegal, those are illegal silicone injections from like Home Depot. They buy their silicone injection. But you can see how it's hard to see, but we have some enzymes able to treat the overinjection or complications, hyaluronidase, which about 80% of fillers are hyaluronidase or hyaluronic acid. And you can see, like on the bottom left, there's too much filler in the lower eyelid, so swelling, and after injection of the enzyme, it's gone. So a lot of these complications are reversible and treated. The key is to identify these complications early, recognize it, and then treat it. And unfortunately, I think some, not all, but some places aren't equipped, don't have the proper medications or treatment, And so I always say, even though it's a relatively small procedure, potential things could happen. And so that's why I recommend people to go to someone who does it a lot, knows how to take care of all the complications, maybe an MD behind the area to supervise, to treat any problems.
Perfect. Thank you so much, Dr. Kim, for being in here in studios. We'll be right back after the break.